Forgetting where you put your keys can be normal. Forgetting what keys are used for is not. One common question I get asked all the time from older patients and their families as a nurse is about memory loss. As mom or dad or grandma gets older and more forgetful, I'm often asked, is this just aging or is this something more serious? Today I'm going to explain the difference between normal aging and dementia in a simple way anyone can understand. Hi, I'm Fairchild. I'm a registered nurse with over 15 years of experience. On this channel, I explain health topics in a clear and simple way so you can feel more confident about your care. Before we begin, I want to say this. If you or someone you love is experiencing early signs of memory problems, please follow up with your doctor. They can properly assess what's going on, decide if testing is needed, and talk about the next steps if treatment is appropriate. The goal of this video is to help you recognize possible signs and start those important conversations with your doctor. All right, let's break this down clearly. So what is normal aging? As we get older, our brains slow down a little. That is normal. Normal aging can look like forgetting a name, but remembering it later, walking into a room and forgetting why, taking longer to learn something new, misplacing items, but finding them later. With normal aging, you still know who you are, you still know where you are, and you can still live your daily life. So then what is dementia? Dementia is not normal aging. Dementia is a medical condition that affects the brain. It slowly makes it harder to remember important things, think clearly, make decisions, do everyday tasks. It's important to know dementia gets worse over time. So what are the key differences between the two? Let's compare them. Normal aging, you forget details, but you remember the big picture. Dementia, you forget the big picture and the details. Normal aging, you forget an appointment. Dementia, you forget what an appointment is. Normal aging, you misplace your phone. Dementia, you put your phone in strange places like the freezer or the oven. Normal aging, you sometimes struggle to find words. Dementia, you stop using words correctly or can't finish sentences. And it's often family who notice these changes first. Other noticeable changes include getting lost in familiar places, trouble paying bills, repeating the same questions, personality changes, poor judgment, confusion about time or place. These are red flags that should be checked out. It is also important to know that there are other things that can look like dementia but are not dementia, such as infections, dehydration, medication side effects, low oxygen levels, vitamin deficiencies. All these can cause confusion. That's why it's important to talk to a healthcare provider for further assessment. Memory changes can be scary, but knowing the difference between normal aging and dementia can help families make the right steps at the right time. If this helped you, save it or share it with someone who may need this information. Like and subscribe for more content like this, and remember to just ask a nurse.